Hi, everyone. Good afternoon, and thank you for joining us today. On behalf of the UCSF Nursing Alumni Association, we would like to welcome you to the Fall 2021 Alumni Brown Bag Session for current students. I am Scott Burning. I am the ASSN Alumni Association rep.
Thanks, Scott. Hi, everyone. My name's Mel Imjafrida. I am the ASSN secretary, and I don't know if Scott mentioned this, but we're both in the FNP program. So today we will be hearing from 5 recent alumni, and they're going to share their insights related to their academic experience at UCSF, but also best practices for navigating that life post-graduation. So before we meet our alumni guests, I just have a few housekeeping items I want to make clear or say out loud. One, this meeting is being recorded so that it can be available to others. And 2, if you have a question, which we highly encourage you bring forth, simply go ahead and chat either me or Scott, or put it in the chat feature, or you could also raise your hand and myself or Scott will acknowledge you, and then feel free to unmute your mic and ask your question.
Great. And now let's meet our alumni guests. The first I'd like to welcome is from the class of 2015 is Ryan Anson. Ryan is a nurse practitioner at UC San Diego Health, where he serves on the Owens Clinic HIV/AIDS care team. We also have Denise Porter. I welcome her from the class of 2019. Denise is a current Nursing Alumni Association board member and is a family nurse practitioner at Mission Neighborhood Health Center. And then from the class of 2021, welcome Megan Jung, a psychiatric provider at Benioff Children's Hospital, Oakland. And we may also, and I think we also just got another one of our alumni to appear. Hi, everyone, welcome to the class of 2016. Andrea Saldana, a family nurse practitioner at Potrero Hill Health Center at San Francisco Department of Public Health Facility. And then we may also be joined later by Adriana Espinosa, who is from the class of 2015. And we'll give a proper introduction if he arrives. I think he actually is seeing patients right now, so he may be popping in and out. And so, Mel, if you want to say to get us started.
Yeah, absolutely. Thanks.
Yeah.
So to each of our alumni guests, in order to get further introductions to each of them, we're going to ask each of them to share just a little bit about their current professional practice. So I think, is it okay if I kind of popcorn and then we'll just start from there? Yeah, I see Denise shaking her head. So Denise, do you want to go ahead and get us started?
Sure, yeah. Hi, everybody. Good afternoon now. It's 12 o'clock. I hope everybody is well. I am currently practicing as a family nurse practitioner at Mission Neighborhood Health Center. I'm not going to say too much about my journey here because I think that'll come up in other questions, but basically, I am doing both adult medicine and also mostly reproductive health services and gynecology care. I'm doing probably about 70% gynecology care, about 30% adult medicine. So that is my current practice. And now recently I started helping with one of the courses at UCSF as a co-facilitator. And so I'm excited to kind of get started on that teaching kind of realm as well. So if there's questions about transitioning to that as well. But I've been here since 2019, the year I graduated. And so far I am happy where I'm at.
Fabulous. Thank you so much, Denise. Megan, would you like to share a little bit about your experience?
Sure. Hi, everyone. I'm Megan. I just graduated from UCSF's MSN program in the Psych Mental Health NP track. So I'm a very new PMHNP, and I also did the MEPN program before that. So I'm happy to talk about that as well. I just started as of a week ago as a Psych NP at Children's Hospital Oakland in their Department of Psychiatry in an outpatient clinic with both NPs and physicians who work to serve children and youth 0 to 21 who who are eligible if they're enrolled in both Medi-Cal and need a higher level of care than their PCPs can provide, but sort of lower than needing inpatient or partial hospitalization care. So the model is to provide relatively shorter term care to stabilize and improve symptoms, and then hopefully graduate our patients back to their PCP care so that we can care for more patients in the community. So if people are interested in community mental health, children and adolescents, therapy, anything like that, I'm happy to talk about that. So thanks for having me.
Congratulations on that new placement, Megan. So exciting. Can we go on to Ryan?
Well, it's great to be here and to see everyone, to meet everybody, current students who are studying hard to be where we are. We wish you the very best in the next few years. I've been doing HIV primary care for the last, losing track of time, 6 years now. I did Megan also, like Megan, in 2012 with Adrian, who I see there on the screen. Nice to see Adrian. And yeah, it's been just loaded with opportunities since. So I started my nurse practitioner career. It's now called East Bay Advanced Care. The acronym is EBAC. It's the East Bay's largest HIV clinic. It had about 1,000 patients who received specialty HIV care and primary care there. So I got a great start there and worked there for 5 years, and an opening came up here at UCSD in San Diego, where the weather is a little bit better and the fires are fewer and far between. And I can't believe y'all are still dealing with that there on such an intense level. So I empathize with you all, but I guess that's our new abnormal in California and everywhere else. But San Diego's been great. Been here a year and a half. Came a month into the COVID pandemic and just adapting to telehealth and trying to deliver both HIV specialty services to a safety net, fragile, vulnerable population with a lot of complex comorbidities is quite challenging. But we figured it out, and part of my other role was doing COVID telehealth for our HIV positive, or patients with HIV who were also diagnosed with COVID, and getting them through that process by phone and video is certainly challenging, but we had pretty good outcomes in our clinic overall, and not many people who were hospitalized or died, fortunately. So yeah, I'm very happy here at UCSD and look forward to hearing from others.
Great. Yeah, we'll have to come down and enjoy some of that warmer weather. All right.
It's balmy 78 today.
Oh, we just had a storm for those of us in SF. Great. I'm just going to go to Andrea Saldana.
Hi, I'm a FNP. I graduated 2016. I just met my 5-year mark of doing primary care, where I thought it would be a lot easier. And I went to school with Adrian. He was ahead of me, and I think I was leaving as Denise was starting. Also did MEPN. I am now doing family practice at Potrero Hill Health Center. It's a DPH clinic. I see across the lifespan, which is new to me. Before that, I was in Mission Neighborhood, and it's pretty like peds sees peds, midwives see pregnant people, and FNPs, MPs, physicians that are not peds see adults. So I did not see any kids or pregnant people my first 2 years of practice. So getting into that 2 years later was for me a lot harder. But I'm at a clinic where people are approachable, and I'm pretty lucky that I get to see people across the lifespan, mostly adults.
Great. I think that may be everyone, though it looks like Adrian just joined us. So everyone, please welcome Adrian Espinosa is the current president of the UCSF Nursing Alumni Association. He is a family nurse practitioner at Bay Area Community Health and Kaiser Permanente Santa Clara. Adrienne, we've just gone introducing everyone and asked them to just give a little bit more about their background and their current practice.
Thank you, Scott. Can you hear me? Yeah, okay, awesome. And shout out to Ryan and Andrea. So great to see familiar faces. And yes, thank you guys. I'm sorry, as many of us are, we're in clinic right now, so running around. But I am from the Bay Area, from San Jose. I was in the MEPA program as well in 2011. Went on to do the family nurse practitioner track. And throughout there, I've always kept a foot in the RN role as well. So at Kaiser, I actually work as an RN in case management still, but it provides a nice balance as I work at Bay Area Community Health now as a family nurse practitioner. And here I see little ones, I see adults. Similar to my colleagues, a lot of us are working a lot with a lot of COVID, pop-up clinics, screenings, etc. We're working with our population. So definitely love working at FQHCs. It's been one of my passions ever since I was in public health, 15, 20 years ago. So I've always kept my foot in the door, working with our populations that, really appreciate us and need us the most. And yeah, still out of the Bay Area. I'm jealous of Ryan's weather over there. I'm gonna go visit him, my cousin, one of these days. But I definitely love my Bay Area and still working here and hope to work here for many more years. Thank you.
Thanks, Adrian. So we're just going to kick it off. And again, if anyone has any questions in the chat, either raise your hand or type them into the chat. But I guess the first question, and let's put this maybe to Andrea. If you could go back to your time at UCSF or as time when you were at another institution, what would you do over or approach differently knowing what you know now?
Knowing what I know now, 5 years in, I wish I would have felt more comfortable treating HIV in primary care and doing that minor. I would have liked to have learned more about substance use disorder treatment to feel comfortable right off the back. I just got my waiver or whatever it's called, that waiver to be able to prescribe Suboxone. I don't know if it would have been that helpful right away, because I think now that I have made relationships with my patients some years in, I feel like I've had more chances when a patients are ready for change to be able to prescribe Suboxone. And I don't know if I would have been that ready right away, but there's just some things I wish I would have realized how important substance use disorder treatment is in primary care. It doesn't matter where you're practicing. Also incorporating more HIV into primary care and feeling more comfortable instead of having to call the worm line a lot.
And Ryan, I think that's where you primarily focused your practice. So I'd love to hear what you would also, if you could go back, what would you do differently, or what did you wish you had learned, or if you could give yourself advice at that time?
Sure. Sorry, I'm turning my heater on and off because it's freezing in 77-degree weather inside. Like Andrea, I also have been challenged and shocked and felt rewarded at the opportunity to treat substance use disorders, particularly stimulant use disorders, which are so frequent and common, I think, no matter what large urban area you live in or rural area. But in California, crystal meth still seems to be king, although fentanyl seems to be dislodging that and competing for space among people who struggle with use. So having that background and experience, if you're able to obtain it in your training locations, in your clinical settings, would be highly valuable, because as Andrea said, it's just so prevalent, everyone's using, and there's not really been great treatment options for stimulant use disorders. The New England Journal of Medicine published one study recently that looked at high dose Wellbutrin, so ramping up to 450 milligrams in 3 days, which, for psychiatrists using that for depression that's very fast titration, but for meth use and adding that with monthly Vivitrol, so an intramuscular injection of naltrexone, also called Vivitrol. We're excited that there could be a signal for effectiveness in reducing cravings and relapse for people who struggle with meth. But that's a big adjustment I had to make in San Diego, is possibly because of the location near the border and near the sort of cartel trafficking routes. it just, sometimes I just don't know what to do when people struggle with, chronic, heavy daily meth use, whether injecting or snorting or smoking or booty bumps or everything. On the subject of HIV primary care, that's my specialty. So I was very fortunate at UCSF to have that. I don't know what the specialty looks like now at UCSF. That's maybe a question I'll put back to you all, but from what I understand the last few years, maybe with some funding and grant changes, it's not as robust as when I was there in 2012 and 13. So I felt very privileged to have taken advantage of great course content. And I had a continuity placement during my NP years there at EBAC, where I was ultimately hired. So I did 2 years of just HIV primary care as a student. So very lucky. I don't know if people have that opportunity anymore as students, but I'm learning more about the field every day. The science of HIV treatment is incredible. But I think, sorry, I'm being a little tangential here, but I guess the thing that I struggle most, certainly as a new provider, and those who started their practice this year or last year probably could speak to this too. It's never a fix, but just the time management is huge in primary care. If, we're lucky we only have to see 12 max patients a day, but other settings are probably seeing 15, 20 at Kaiser, maybe it's 30 or 25, something insane like that. But the more you can learn time, I did not get this sort of great support, or it was maybe my fault. I didn't ask for it, but my preceptors in clinics didn't emphasize how important time management was as a student, and the faster you can learn that, even if you're in your first year of rotations, just the better off you're going to be once you're in practice, because you don't want to come home with 10, 15 notes at night. And primary care, that's sometimes what it looks like. It's a marathon. It's like a marriage. You just you gotta peaks and valleys, and you gotta have some stamina, and some days are better than others, but just trying to figure out a way to, document well and thorough in the beginning, but figure out how to just be on time, on track with your visits and your notes. So, pushing yourself to do that as a student and pushing your preceptors to support that and encourage it, I think would be very valuable. That's it.
Thank you. That's something very helpful. I think we've noticed initially, just sort of while going over sort of drafting notes, the amount of time that it can actually take to get them and to have them be readily available, and also for other people to use instead of just my own sort of shorthand notes, but something that could be easily provided to another provider. Denise, do you mind answering the same question?
Sure. I think in terms of my education, looking back at UCSF, first of all, I want to say I'm grateful that I graduated pre-COVID. I think that is a huge thing that I'm now look back on, and I'm like, wow, like my respects to you, all you students that are going through the pandemic. So I think that's one thing. In terms of education, I think I wish now that I do a lot of reproductive health services, and I'm trying to offer, have it be more of an inclusive space. I think that I wish that that transcare was integrated within our gyne classes, like courses, versus being like supplementary or extra, on the side kind of things that you kind of have to go and learn. I think it needs to become part of what is actually taught within the curriculum. Also, I would say I didn't have as solid of grounding on lab interpretation and like imaging results interpretation as well. Like I felt like I used a lot of time like looking up or like consulting on these things because it didn't, I wish it would have been integrated within like our signs and symptoms or something kind of courses. Like what would this be like if it was these values came up for this disease, or something like that. I felt like that wasn't integrated into our education as well. And then in terms of just the bigger picture, I feel that I'm having a challenge in continuing to keep nursing in the forefront of my practice, like my nursing broader perspectives on like holistic care, addressing social determinants of health, in that nursing perspective, I feel that we're once we're in any FQHC, any DPH, we're basically more working as medical physicians, you know, kind of like in that model of medicine in that way, and kind of going through the day, you know, more, you know, getting that, like Ryan said, like getting all the 12 patients in, and, you know, and our time management and all of that. And I feel that sometimes that nursing aspect gets a little bit lost in the cloud of all of that. So I'm constantly trying to, you know, remind myself, and I put it within my, you know, templates, within different things that I use within the visit, to try to always integrate education and, you know, asking about other things, not just centering the complaint, but also centering what other things are happening with the person's life, you know. So I think that that constant struggle of us always like keeping that in the forefront is really important for me, because that's why I chose a nursing school, you know, that's why I chose to be an NP. So yeah, and then prioritizing work-life balance. I think, you know, I have 3 kids, and I want to prioritize them in my life, and so how to do that. And I think advocating for myself to only work 4 days a week, to only, you know, to balancing it out between doing adult and gyne focus. I think that has helped me balance my practice more. Mm-hmm.
Thank you.
Mhm.
If Adrian or Megan, you'd like to continue on this question, or if you have something to add, or we can also switch to a new question. But I'm sure people would love to hear what you learned, what you wish you had learned more at UCSF. So I can go back to you.
Megan, if you'd like to go first, or
Sure, thanks. I agree with what everyone has said so far. And another facet that I would add is that I wish I had learned more about healthcare economics during my time at UCSF, and understanding healthcare and the insurance industry, and how the structures of American healthcare, especially as providers here in America, how those function. You know, Denise talking about keeping nursing at the forefront, about nursing being about advocacy and education for parents, like not knowing how the insurance industry really works here, and how like hospital billing really works, and being able to talk to our patients about what that really means for them, I think is super important. And I was able to find an elective course. I think I even just went through like the whole roster every quarter, because I just didn't know what electives there were. It wasn't broadly advertised, but I took a really great healthcare economics course that I wish I could remember the name of, and I'll think of that. That was super enlightening, and I wish I had had more time to get into information like that. Adrienne.
all right. So ditto what everybody said. With as far as, you know, more insight on substance abuse, a lot more on mental health, also trans health. I mean, these are all things that definitely, I think at one time or another, I wish I had more background on, but I do try to make use of our resources that we have around here and our colleagues that are knowledgeable in it. So those are all great. I definitely want to touch on what Ryan mentioned. I think, and Denise, I think self-care and reminding myself back then that work-life balance and just being able to be better at time management is key. When Ryan was joking around about the, 20 some patients, that's me. I see, sometimes up to 23 patients a day. Every other week I work 6 days a week. I don't have good balance. And that's just the honest truth. I love what I do, which is a great thing, right? That's if I didn't love what I was doing, then obviously I would be miserable. But there are times where I'm, tired, I'm a little stressed, and I'm trying to still figure out that balance. But also feeling like I'm in the, newer part of the first 10 years of education. I think it's also important to gain as much as I can, experience, and do as much as I can. So, but definitely wish I would have worked a little bit more on my charting skills and time management back then, because I'm still working on it now.
The work in progress, right, Adrian? And
yes.
You're an enlightened, evolved individual, and I'm sure a great provider. But I sorry to, I don't monopolize that topic, but the work-life balance, kind of even if you're in specialty care, but definitely when you're doing, no matter if you're an FNP or AGMP or a psych MP, our patients are complex and you want to provide the best care you can, but the balance suffers. I honestly, I definitely felt that, especially during COVID, and also hats off to you students who, I mean, not that COVID's gone away, but just whoever got through this pandemic and got their education done, just blows my mind. So well done. But as you graduate, or, you know, if there are ways you can do some self-care, just like the time management thing and charting thing, figure out those models of self-care, particularly if you have families. You don't let your family life suffer, because mine has, and just being honest about that, and you know, think about your priorities, your priorities in life, and you know, hopefully work is secondary and not the top one.
Yeah, and remember, we are nurses, and as nurses, you know, we're all about taking care of others and making sure they're okay, but we also have to remember to be, you know, that same nurse to ourselves and to each other. And just also to mention, I think that's when it's important to have great colleagues. I have amazing relationships with friends, colleagues I went to school with, that I met along the way, that are family to me. And if it wasn't for them, I mean, God, I don't know, I'm just so thankful to them, because they've helped me, you know, stay sane and have good times, laughs, be able to vent. So I think it's really great to also, during your school time right now, make those connections, because I have a lot of great friends still from my schooling and beyond, and I'm very thankful for them. Okay, Scott, you probably go to the next question. We're going to vent for a very long time on this topic.
All right, I'm hopping in. Well, I just wanted to pause and see if there were any questions. If you want to raise your hand and or type it in the chat, just wanted to see. If not, we've got a few questions that were submitted prior to that we can move on to. But I always want to take that opportunity to say, hey, after we've heard some of these amazing bits of advice, you know, honest feedback, like in terms of work-life balance, if any questions were springing up. Okay, scanning through. All right. Yeah, is that Andrea?
Maritza.
Okay, Maritza.
Thank you. After Megan was mentioning like the elective that she took, and I think Denise said something about like resources from the courses, I'm wondering if there are any classes that like were kind of the life-changing classes in the program, and like that are the ones you would suggest to like really focus on and really learn the material from those classes, or any electives that you think were really like that, you know, those are the ones that you are really bringing into your practice.
If I may, really quick, I was a minor and fellow in the diabetes program. And even if you're not doing the minor, whenever you have classes with Dr. Carolina Espinosa Noya or Maureen McGrath, they are gems. They are people that you want to absorb and learn from, because you will see, for the most part, if you're in primary care, etc., you will always be seeing your patients with diabetes, you know, other chronic conditions, and they help me not to be afraid of. I mean, I grew up, one of my inspirations growing up was my grandmother. You know, she was type 2 diabetes. She had type 2 diabetes, and we used to provide insulin for her. And I remember the smell. To this day, if I smell insulin, I think of my grandma. And back then, I didn't know why, you know, it was happening or why she was ill. And so being one of my inspirations later on and learning about that, it really, you know, was a driving force for me to want to learn more about it, and to this day in my practice. But I had this sort of little bit of fear of, you know, titrating insulin and doing this and that. But thanks to them, I feel so much more comfortable, and I feel like I can do it. And it's a topic that I enjoy and I really value working with my patients on. So anything related to diabetes, chronic care, absorb it.
Fabulous. Any of the other alumni kind of have a course that we should take? Megan, you and I can maybe search for that healthcare economics course together to see if we can find it. But any other courses?
I don't know if it's still available, but in addition to my HIV minor, I did a psychiatric nursing minor. You just get a little certificate at the end after taking 3 classes. I worked as a psych nurse while in school, and so I was in acute psychiatry in inpatient settings. But just learning about those psychotropic medications made me, I think, much more comfortable to my colleagues in terms of prescribing those in primary care. Second generation antipsychotics, not being nervous about that, just doing it, especially with all this sort of stimulant-induced behavioral issues, and sometimes these treatments are shot in the dark. But you know, if you're the only person in your setting with experience doing that, I mean, why make a patient wait 6-8 weeks to see a psych MP or a psychiatrist? You know, just start something and be comfortable with it and change it if a patient doesn't tolerate it. But so if you have opportunity, even take that one class that Megan made me speak to, I forget the names of them. There's, gosh, the instructors were great. I think they've all kind of changed since I was there. Beth Phoenix, I don't know if she's still involved, but there's a psychotropic medication class that's phenomenal. And then the signs and symptoms of mental health, maybe they renamed it. I just found that to be really good. So if you can squeeze that in your curriculum, it might help when you're in primary care. Even if you're, you know, FMP and treating kids, all that stuff helps.
On that note, I probably have a bias here about advocating for more psychiatric mental health care education for everybody. And I mean, I agree with Ryan. It's unfortunate you have to try to squeeze that kind of learning in, especially for folks who are going to be in primary care, working now with primary care providers. Like, they hold so much. And they need to be able to know how to prescribe, you know, antidepressants and antipsychotics. And unfortunately, this is another like systemic issue with how our healthcare is organized in this country, that primary care gets saddled with way more than it really should. And so as a, you know, more of a specialty care provider, like, I encourage everyone who's going to be in primary care, like, get some psychiatric education, and then also get really close with your psychiatric providers when you get out into primary care.
There is, when you graduate, if you live in California, there is a free like $15,000 scholarship. It's paid for primary care psychiatry, as long as you practice in California. And I did it during the pandemic. I did not finish. I think I was just it was too much for me to do work and weekly webinars and stuff. But I think it would have been really good had I been able to finish it. But there's a psychiatric primary care fellowship. It's a year long, it's doable, and it's free. And as soon as you find a job, you can apply for it, because you don't need to know everything right when you finish. There's just too much that you need to get good at that you just can't do it in 2 years.
Yeah, I wanted to touch on that because I know we're giving a lot of advice, but please know, yeah, that you're not going to know all of it, and a lot of learning does happen once you graduate. But we're just hoping to give you some highlights of things to, you know, put a little sticky there, a little post-it there, and you know, if you can, a little inspiration to remember certain things.
UCSF, I believe, has a relationship now with UCSD, and they might also offer that similar virtual coursework that Andrea described taking. But Roz, Megan, I don't know if she's still involved. Yeah, she would know about it. I think it's all over the school nursing website now under the psych mental health specialty. Just piggyback on Denise's comment about gender affirming care, it's so critical in our world now, so important, being able to talk about gender identity, trans health, if you're working with any transgender patients, learning to talk in primary care is super important, to be very comfortable talking about sex and how people like to have sex and who they like to have sex with, HIV screening, no matter what. Part of my job at EBAC was running our emergency department-based Hep C and HIV screening program, and just testing everyone in opt-out fashion, just kind of adding it on if they're at higher risk once a year or more frequently, depending on what they tell you about their risks for HIV. But you know, always following that USPSTF which I'm sure the professors are beating India as far as preventive health screenings, doing that one-time test for on every patient. STI rates are through the roof every year. They go up and up and up. HIV incidence, I think with the COVID pandemic, is increasing definitely in some states because people just didn't have access to getting regular tests. So just general sexual health services, and most importantly, PrEP. I don't know if they're doing that at school, if you all have some experience with PrEP or learning about PrEP or pre-exposure prophylaxis. Also, the life-saving pill, take it once a day to prevent HIV. I would hope to God that they are teaching about PrEP now in all nursing schools, but still shocked when I see new patients asking to come to start PrEP with me. I've prescribed it to hundreds of people, and they'll often say, "Oh, I talked to my primary, they didn't know about PrEP, or they didn't know how to prescribe it, or what labs to check," and that's just totally useless and lame. And those, I'm going to be very judgmental. They should not be in medicine and not be doing primary care, or just go back to school and learn that. And you don't even have to go to school. You take a 1-hour webinar online. It's so easy to prescribe, but PrEP is so life-saving for a lot of people. So please learn about PrEP.
Good. I think, at least for the MEPN course, we did get a PrEP mention, but we'll definitely explore it more. I do want to be cognizant, just doing a time check, we're almost at 12:40. I know that Andrea Masters and Amy Mosley have a question. So Andrea, would you like to unmute and ask your question?
Sure. Yeah, so I'm in that PMHNP certificate program. So I'm in a primary care FNP that did that certificate program. So Ryan, the psychopharm person you were probably thinking of is Andrew Penn. Any classes that you guys can take with him, boy, for psychopharmacology, he wrote the book. He's really great. But and that is a one-year program offered through UCSF. It's a collaboration with other UCs, including Davis, which Roz is still teaching in this program. Yeah, but my question is, I'm at the end of it now with 6 weeks to go, and if there are any psych NPs, sorry, who recently went through the program or can shed some light on preparing for the board exam. That's what would love to hear about, anyone's experience with review programs or review materials that they used. Any tips or anything you might be able to share about the board exam.
I'll take that one, since I think on this panel I'm the only psych person right now. And for the exam, unfortunately, unlike with like the NCLEX, where UWorld was sort of like the known prep program, there wasn't really one that the people were universally fans of, at least in my cohort. And so there was a lot of collaborating together on study guides, like within our groups, not as much kinds of like study how to take the test or study how to do the types of questions similar or as it was on NCLEX, and more about like knowing the broad categories of things. And there is a lot to cover, but I think it was generally easier than NCLEX, if that's any help. And there's no studying that goes wasted, I think, and maybe that would be true for the other specialties, I don't know, but it felt like this is information that I'm going to want to learn and keep with me. And so everything that I learned and studied, I'm still using now and reminding myself of now. So I hope that that's helpful. It's not a very satisfying answer about, what test program to use, but hopefully that can guide a little bit of your studying.
Yeah, thanks. So nothing like Saunders. I found Saunders for the NCLEX or the NCLEX was a nurse practitioner boards, right? No, that was the RN. Yeah. RN was harder. So and for the NP certification, that's where I found Saunders incredibly helpful, way more so than Kaplan. Just for anybody else who's preparing for that exam. The Saunders was really helpful.
Then there is, at least for adults, I don't know if this is, do you take boards now by specialty? Maybe it sounds like, okay. There's that old Southern guy who did these like 3-day, he used to do it live, but I'm sure you can just do everything virtual now.
Is that Carlot? No, who is?
Mark Klimek?
Oh, he thinks he's very funny, but he's from the deep South and has all these funny, he thinks they're funny jokes. Anyway, he was doing it for years for the adult specialty. And I somehow found his old DVDs or however old that was on Amazon and listened to it that. But just hearing the content rather than reading out of a book I found to be helpful. You can do it in like a day or two. It's been so many years. This is like 2015 or 14 that I don't remember his name.
Yeah, I just learned a big lesson with studying for boards is, don't overstudy and the right thing. So just my experience, it sounds like there's a lot of FNP students preparing to take it is, it's the NP boards are a lot better than the NCLEX, that's for sure. But overstudying can be an issue. Just study, really, I can't say enough about Saunders. That prepared me really, really well. And for the NP board, I was done in a very short amount of time. But I had done the Kaplan review first and bombed it the first time. So just, FYI.
Thank you. I'm going to go to Amy's question next. And she had asked, what kind of support did you get from your workplace when you first were brand new practitioners? And anyone, maybe Andrea, if you'd like to, or Denise, great to hear from other people.
What was the question? Sorry.
Oh yeah, what kind of support did you get from your workplace as brand new practitioners?
Okay, I'll take a quick stab at it. So when I came in, I kind of had heard from everybody about, like everybody meaning faculty and FNP and different folks that I'm a first generation student. And so I had never, had anybody in my family work in the medical field or anything like that, or I had no idea what the workload or anything would be like. So I really leaned a lot on the advice that I would actively ask faculty and people that I knew had worked at FQHCs, because I knew this was the population that I wanted to work with. I used to work as a medical assistant in an FQHC many, many years ago. And so I kind of knew the load a little bit, but then as a provider, that's a much different ballgame. And so basically they were like, advocate for yourself, advocate for yourself, advocate for yourself. And like, in terms of not just even pay, but I would say even since you're a new grad, there's less of a chance that you'll get increased pay as coming into an FQHC in terms of advocating for yourself for that. But I think about other things. For me, it was making sure I only worked 4 days a week, making sure that I had admin time that was allocated for charting and not meetings and other things like that. It was also making sure I had, at that point, I advocated for myself to get reimbursed for like other things like CEUs and other things that then they implemented more and more of as of now. So it's been good because they took that on more seriously for everybody else as well. And then also like doing a ramp up instead of just having a full load right away. I've heard other folks that work in other states that are my peers that graduated that got kind of thrown into like a full load right away. And that was really, harmful for, their burnout rate was pretty much they're burning out at this time. And so for me, I was very adamant about, okay, I really only want to see these amount of patients per shift, which is in the world, in clinical world, you work in shifts, and then how many people you see per shifts is basically how they put it out. And so I said, okay, this is what I would like, even though you can't give me this amount per hour. This is what, I see myself working and practicing as a safe for, student. I think one thing that was in my advantage here at MNHC was that I precepted with one of the providers here during my year-long clinical preceptorship during my F&P, my second year. So I think that was one of the reasons why I applied to a job here, was because I knew the system, I knew the, EHR, I knew like everything, like the medical record system. I knew, kind of the staff, the culture, the patients. So I felt that that was, helped me transition into being an nurse practitioner here. I didn't have to commute very much. I think that's another big thing, thinking about your commute. I could have applied also at La Clinica in Oakland, where I was also doing many hours at. But for me, that 30 to 40 minutes commute every day in the morning and the afternoon means more time for charting later, and that would take away from my kids and my family and myself after. I couldn't do a dinner, I couldn't do this or that. So I think those things are where I was like, no, this is in the city. It may not, no place is perfect. Every place has its, issues and things that you have to work out, but what in the bigger picture makes sense for your life and how, the balance that you need as a person as well. So I think there's a lot of little bits that you can take into consideration. And then as soon as like 6 months hit or so, when it was ramping more, I kind of checked in again with my, medical director, and I was like, this is how I'm doing, this is how I'm feeling, this is how, and I did that. Like it wasn't integrated for them to do that. And it's not done that way. Usually people don't do it, but I think you've got to be your own best advocate for these kinds of things, or else you will burn out. And I still want to be here for the community. So that's my job, to be here still.
Thank you. And Andrea, it looks like you maybe answered some of this question in the chat, but just for people that are watching the pre-recorded lecture, if you could just let us know.
My first job, the medical director was familiar with new grads. I would be very cognizant of where you're going. If the place does not know what a new grad NP is, I would stay away. I've seen new grad PAs be fired in primary care, their first job in, who should not have been fired just because they went to an environment that wasn't suited for a new grad. So be like, when you go to your interview them. My first interview, the place did not really understand what a new grad was. And I don't think either of us were wanted to hire each other. So, but my first job, I had weekly check-ins with my medical director. He was my physician supervisor. And he made an hour a week to check in with me about cases. And then now I either go with the medical director I have now, like as needed, I make time with her to consult. But making sure that the place you're going to knows what a new grad is, and making sure that whoever hires you is approachable so that you can consult with them.
Is there time? That's great advice. And is there time for me just to add on to that?
Please go ahead.
Briefly. I would concur, and because you ask multiple people, sometimes it's just kind of you grab whoever's available, who's got more experience than you, and you just have to live with that. But you'll often hear a totally different diagnostic or management approach from 3 people. So like Andrew was saying, try to hone in on that one person whose clinical practice style you mesh with, because there's some people who just like, what? Like, why did you make that decision? There's always never necessarily 2 right ways to do one thing, but I think it'd be less confusing if you just stick with one person, as long as that person is available. And Andrea, to have an hour a week, that's amazing And if you can negotiate that during your interview, I think, like you were saying, advocate for yourself and what you want. Because yeah, and requesting that ramp up is so key. Otherwise, I mean, yeah, I heard of classmates burning out of primary care within a year or less even. So just get that slow titration on in your schedule, and having this regular consultant, maybe if it's not once a week, that's real. I've never heard something that regular, but even like once a month, collecting your, 5, 6 complex cases and just sitting down, even once a month can be beneficial, but once a week, even better.
Thank you. I don't know, Mel, if you wanted to start with another question for the people. I know we only have about 8 minutes left, so maybe we could do sort of a speed round type of questions.
Fabulous. Well, I think we had touched upon some good aspects of post-graduation life in terms of what they should be looking for when you're interviewing. They're not just interviewing you and you are interviewing them. Just a speed round of any other advice on how to navigate post-graduation life in terms of networking or finding that mentor other than what was already said. And is there anyone who wants to jump in from the alumni?
I'll go really quick. I think value definitely, as you mentioned, having those networks that you made during your school time with professors and colleagues alike. I've also been very involved in the community with community partners and also in nursing organizations, Latinx nursing organizations, and these have provided opportunities for me to do presentations on that have advanced my career development, but also allowed me to network and learn about a lot of other topics and people who I can reach out to when I have questions. So definitely keeping an active network open, because I think that really helps to fuel your spirit when you need it, but also provides a lot of opportunities to learn and to go out there to the conferences, etc. And that's another thing, finding out if your employer provides compensation for you to be able to go attend conferences and giving you a stipend, etc. Because that's always a great perk, and being able to be in the professional world and go learn and get paid for it.
One piece of advice I would give in terms of like prepping for a job is I didn't realize how much money I would need to spend at the beginning, for licensing and DA and all of this other stuff. So having a little cushion, I would say almost around $2,000 at least, 1,500 to $2,000 of for that transition period right after you graduate, because I'm basically the breadwinner of my family, and I would right away need to get a job. I needed to get a job right away because I wasn't going to have any kind of student loans anymore. I needed to pay Bay Area housing prices. It was real. I needed to get a job right away so that I could pay for my housing. And that was a real challenge for me. And so I went to the career center, career center where they go and look at your resume and all that during spring quarter and winter quarter. And I met with them and they reviewed my resume and I told them this is what I'm interested in. And I did both a resume for RN jobs and for NP jobs, because I knew, okay, if I didn't get a job as an NP, I could get it as an RN, which I actually think that's a really good thing that Avian does. And I've heard a lot of people work both jobs. That's another good way of keeping nursing at the forefront, and a balanced schedule as well, and money wise too. And so I did a resume right away, and then also like I said, saves a little bit of money from, actually, because I didn't have a lot of extra money, it was money from my actual loans part that I saved money from to pay for that stuff for after, it's really expensive to pay for all of this stuff. So I did that too. So just little advice on that.
And that is definitely something to ask about when you interview, if they cover those expenses.
Yeah.
Because you have to seek relicensure. It's also, if you have all these specialties too, and even just your furnishing license, your MP license. This is shocking to me, but UCSD does not cover that. I also have to pay for my own reappointment in the health system to work here, which is
wow.
It's like, I mean, $200. I think is it every 2 years or every year? I don't know. It's too much, whatever it is. I mean, employers should be paying for that stuff, so ask for it. You know, it's ridiculous that we have to pay, and we also don't get paid conference hours. Those are the basics. The CME, I mean, I don't know if you want to turn down a job just because they won't cover it, or if they only cover 1 or 2 of those. You just got to get your foot in the door somehow. But long term, when you like a place, it is appropriate, and really it's kind of the industry norm, and all that stuff should be covered by your employer. And DA license, but DA costs what, $700-800 a year to renew. If they're not covering that,
I think DEA is 900 now, I believe.
Yeah,
Yeah.
lots of money there. So ideally, you should shift all those costs to the person that pays you, who should always be paying you more, no matter what. And don't be afraid to ask for salary increases regularly.
Okay, no, and it's always good in terms of budget planning. So thank you so much for that. Any of the other alumni that didn't get a chance to chime in? Okay, Scott, do you want to take it from here?
Yes, happy to. Maybe just, we have one time, quick question round, which I always love. What is your favorite acronym that you've been using in practice that you learned at school? So just really quick favorite acronym. And try to stay away from old carts if you can, if there's something else that you've really found useful. I'm going to start off with you, Adrian.
You got me there. I don't think I have any. I tend to write things out and just and I forget something, I look it up, but I don't have any acronyms that, oh my God, it's horrible, because I lived by acronyms in school. So honestly, but I can't think of one right now at the moment. Oh, I feel horrible. Anybody else?
I am always, and I mean, you know this, Scott, old cards. Like, I think even in the moments where I'm like a little bit, you know, like, oh my gosh, what happened here? The conversation gets deviated, or, you know, we're going down the, you know, spiral. Like, I think that always going back to your old cards is good. So sorry.
No worries, thank you. Megan, Ryan, or Andrea?
If you are working with teens or youth, I often structure my interviews or appointments around a heads assessment, which is probably my favorite way just to strike up conversation around home, education, activities, drugs. What's the other one? Sex and suicidality. And you kind of just cover all the things that you need to with people in that age range or older as well. So I like that one a lot, and makes it sort of easy and comfortable in talking around a lot of different things.
I took that for granted. I use that all the time, Megan, you're right.
It's just second nature, because you just always ask about those things, right? How's school? How's home?
I don't even remember what OCART stands for, if I'm honest. I guess I'm like Adriana, just write it out. And if I forget something, which is often, I just look it up. Up to date will be your buddy.
Yeah.
Well, that's about all the time we have today. So before we go, I just wanted to mention UCSF Connect. And this is from their website. It's the official networking platform of the UCSF community. And it helps students obtain support from alums so they can explore different career paths and build their professional networks in addition to something like this. And I just put in the link to that. We're hoping in the future to roll out a mentoring program with the alumni and the students that's going to utilize that. So if you want to check it out, that'd be great, a little ahead of time. But with that, I just want to, on behalf of me and all of the Nursing Alumni Association Board, thank all of our alumni guests for their participation and for everyone for joining us today. And if that's it, if anyone has any other sort of final words, that'd be great to hear.
I just want to say thank you to everyone. And also, like I said, as an incoming president of the Alumni Association. I'm so excited and proud to be here. And I thank our alumni that joined us today. And I hope that we'll be a lot more visible for our current students and for our alumni network. So thank you guys so much.
Thank you.
Great.
Good luck to you in your training.
Yeah, thank you everybody for joining. Good luck to everybody in the training and during this ongoing pandemic. And yeah, I would say one last thing that I wanted to say was taking the racism, healthcare, and social justice courses, and now I know that has expanded to more specialties, is great. I think that keeps, especially working in underserved communities, and many of us here actually on the panel do. That's why this came up for me right now, is making sure that you all keep that at the forefront.